Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and that's all I do. I just perform aesthetic or cosmetic surgery. I perform a lot of fat transfer in my practice. I've been doing it for 15 years, and almost every day of my practice in the operating room, I will perform fat transfer or fat injections. And a common question that I get from patients that come in for consultations, Dr. Shapiro, what areas of the face are best for fat transfer? And the answer to the question is really almost all areas of the face are great for fat transfer. Remember, fat transfer is not just the injection of a filler, it's a fat transplant. So again, the most important decision you'll make regarding fat transfer is who performs the fat transfer procedure. We want that procedure to be performed very technically, with a lot of technical expertise. We want that fat to be handled very delicately and injected very delicately. Areas of the face that most commonly are treated would be some hollowing beneath the eyes, hollowing of the upper eyes. I commonly will treat deep nasolabial folds. I commonly will treat along the jawline. If somebody has a weak jawline, I will augment that. And again, in patients that seem like they've lost a lot of volume in their face, I will inject the temples and also the cheek region. More is not always better. And I know that you've seen people walking around town that have moon faces, so that's poor judgment on the surgeon's part. So the best way to figure out, if you're a candidate is to come in and talk to a plastic surgeon, probably me, and get an idea whether fat transfer is right for you. Again, there are many areas of the face that can benefit for this. It's a very precise procedure that really requires a lot of technical expertise. Commonly, I will inject, as I said, beneath the eyes, above the eyes, the nasolabial folds. I'll inject the lips. I'll inject along the jawline, along the chin. Oftentimes, I will augment the chin in patients that need some more fullness along the chin region to get better proportion. And lastly, I will inject along the forehead and the temples. After about 3 weeks or so, I think that fat has a long-lasting result. In my practice, I get very little reabsorption, but still there are some patients that will need a second injection, and the beauty is that can be performed in the office. A lot of fat transfer is performed under local anesthesia in my office. Others are performed while the patient is asleep, and I'm performing like a facelift or a breast augmentation, etc. So fat transfer is an amazing procedure. There have been huge strides in this particular technique over the last 10 years. And in my mind, it probably is the most important advancement in plastic surgery in the last 10 years. So to figure out whether you're a good candidate for fat transfer, come in and we'll talk. I'll tell you what I can do for you. Oftentimes, I will have very thin patients that come in and they will need to put on weight, so at least I have a donor site to put the fat in. So the whole face is a wonderful area for fat transfer, and again, it needs to be done precisely in a way that nobody should know that you've had it done, because we want to make you look beautiful and not weird. All right, so best way to get an idea is come in for a consultation and we'll go from there. Thank you.